Hi. Most mothers want to breastfeed their baby exclusively till 2 years as recommended by the World Health Organization or even beyond. And some mothers may start wanting to wean off according to their routine situations by 1 year or so. And after 1 year of age, if they decide to reduce the frequency of breastfeeding or stop, obviously we don't discourage them actively, but we encourage mothers to continue to breastfeed as long as possible. And the longer the time duration, the better. Many mothers stop breastfeeding if they get pregnant again, and I've seen occasional mothers who continue to breastfeed during the initial stages, but definitely it's better to wean the first baby off the breastfeeding at least a few months before the new baby comes, because that's a risk of sibling rivalry as well, competition for the breastfeeding. So the mothers who did continue to breastfeed when the second baby came do struggle a little bit with the emotional aspects of it. Once the mother decides to wean off, in some mothers it works very easily. They've already weaned the baby well, they've started giving either formula milk or cow's milk. It's always a good idea not to use a bottle if possible as the child gets older, because a bottle is not good for the dental development and the caries. Cup feeding, you get sipper cups which can be used, and this is a good option. They can start gradually giving express milk if the baby doesn't take any other milk, and then bring in the other milks. If they have an older sibling, comparing or competing with an older sibling when they drink additional options of milk will be an option to get this baby off the breast milk. There are, however, some babies who are very clingy and they refuse to come off the breast. So is there any specific tip for that? It's not easy. Obviously it's an emotional attachment for the baby as well as for the mother, and we shouldn't take it lightly. It shouldn't be abrupt. We can reduce it during the day. There are distraction techniques which will help bring in foods that the child likes, and substitute, as I said, compare with a sibling or compete with a friend. They start looking at other children at this age, so by 1 to 2 years they are aware socially, and you can make use of this during the day. But at night, maybe start sleeping separate, because the smell of the mother and the feel, the voice and everything else makes the baby want to feed even though they're not hungry. So always give a good milk feed before the baby goes to bed. In this case, let the baby sleep with the father, for example, for some time. I always tell parents that a holiday is a good time when you can make changes, because the child starts associating some change with what is happening, with the change in environment, the new place, the excitement. If you are visiting your family at home, for example, if you live overseas, or if you are going on a holiday abroad, you can use this as an opportunity to make changes like stopping breastfeeding. In these cases, you have to be abrupt, and you could start weaning before you start the holiday, and then during the period you just make this change and hope that the child adapts to it. It's not always going to work. These are just a couple of simple tips. If you have any suggestions, do mention in the comment as well. Thank you.